Alright, let's dive into something that's been making waves in rural healthcare, and trust me, it's more fascinating than it sounds. So, Jerold Phelps Community Hospital in Garberville just started offering outpatient MRIs, and I've got to say, this is a big deal, not just for the locals, but for anyone who's ever thought about the challenges of healthcare in remote areas. Here's the thing. Before this, folks in Garberville had to drive hours, to get an MRI. We're talking 2-hour drives each way to places like Eureka or Willits. That's a full day of travel just for a scan. What makes this really interesting is how this small hospital is tackling a massive problem with a surprisingly simple solution, a mobile MRI unit. Personally, I think this is a brilliant move. It's not just about convenience, it's about accessibility. Chelsea Brown, the outreach manager, said it perfectly. We're in a very vast, rural, and isolated kind of environment. Anything we can do to bring things closer to home for people, we try to do that. And that's exactly what they're doing. This mobile unit isn't just a Band-Aid fix. It's a strategic partnership with Heritage Imaging, a company that specializes in bringing imaging to rural areas. What many people don't realize is that rural hospitals often can't afford their own MRI machines, let alone have the demand to justify one. This partnership model, it's a game changer. Now, let's talk numbers for a second. The hospital aims to scan up to 10 patients every Saturday. That might not sound like a lot, but in a rural area, it's huge. And here's a detail I find fascinating. They chose Saturdays specifically to accommodate full-time workers. It's a small thing, but it shows they're thinking about the community's needs. Since opening day on July 11th, about 15 people have already gotten MRIs, and the feedback? Overwhelmingly positive. People are happy to have this service nearby, and honestly, who wouldn't be? But here's where it gets even more interesting. This mobile unit is just the beginning. The long-term plan is to add MRI equipment to the new Soham Health Hospital and Clinic, a $100 million project they're hoping to start next year. If you take a step back and think about it, this is a massive investment in a rural community. It's not just about the technology, it's about the message it sends. We're small, but we're mighty. And that's exactly how Chelsea Brown described it. What this really suggests is that rural healthcare doesn't have to be a second-class experience. With partnerships, innovation, and a bit of creativity, hospitals like Jerold Phelps can provide services that rival those in urban areas. In my opinion, this is a blueprint for how other rural hospitals can approach their challenges. It's not just about the MRI, it's about the mindset. One thing that immediately stands out is how this initiative addresses a broader issue in healthcare, the urban-rural divide. Rural communities often get left behind when it comes to medical advancements. But this is a step toward closing that gap. And it's not just MRIs. Jerold Phelps already offers advanced X-rays, CT scans, ultrasounds, and 3D mammograms. They're building a comprehensive diagnostic imaging lineup, which is huge for a hospital of their size. If you're thinking, well, this is great for Garberville, but what about other places? Here's the kicker. They're open to patients from outside the area too. If you're willing to make the drive, you might get an earlier appointment. It's a win-win. So, what's the bigger takeaway here? Personally, I think it's this. Healthcare doesn't have to be one-size-fits-all. Rural communities have unique challenges, but they also have unique opportunities to innovate. This mobile MRI unit isn't just a service. It's a symbol of what's possible when you think outside the box. As we wrap up, I'll leave you with this thought. What if more hospitals took this kind of proactive approach? What if we saw more partnerships like this across the country? It's not just about technology. It's about accessibility, equity, and community. And that, my friends, is something worth talking about. So what do you think? Is this the future of rural healthcare, or just a one-off success story? Let me know in the comments below. And if you found this as fascinating as I did, don't forget to like, share, and subscribe for more stories like this. Thanks for watching.